Hello and welcome to Inside Indiana Business. I'm Gary Dick. Rural communities throughout the United States are dependent upon their local hospitals in many ways. Not only do they provide care to the 1 in 5 Americans who live in rural communities, they're often these communities' largest employers, serving as a cornerstone to both the economic viability and economic development of rural America. Now, the American Hospital Association is projecting that hospitals and health systems throughout the country could lose more than $320 billion this year as a result of the pandemic. According to research by the University of North Carolina, 170 rural hospitals have closed since 2005. 8 rural hospitals have already closed this year. In Indiana, it's estimated that 8 rural hospitals are at risk here. Now, the Indiana Hospital Association is out with brand new data that shows Hoosier hospitals experiencing negative operating margins in April as the pandemic tightened its grip. Hospitals throughout the state report inpatient volume fell 26%. Emergency care declined by 40%. Outpatient surgery and other outpatient services plummeted about 50% each. Now, these sharp declines mean Indiana hospitals are facing significant financial challenges, and a new report puts numbers to the pain. Business of Health reporter Kylie Veleta is here with more. Kylie.
Thank you, Gary. The Indiana Hospital Association says hospitals in the Hoosier State reported a negative operating margin of minus 8.3% for the month of April, the latest data available. And the numbers are even more grim for rural hospitals in Indiana. Here to tell us more about the report is Brian Tabor, president of the Indiana Hospital Association. Brian, thank you for being on the show today.
Thank you for having me, Kylie.
Well, let's talk first about the causes of this financial strain for hospitals, because some are obvious, but others not so obvious. So we already mentioned the drop in outpatient services and the use of the ER, but what other costs did hospitals have to shoulder?
Yeah, it's a great question. At the same time, throughout this pandemic, what we saw was as revenue fell, as described earlier, costs rose, and there was a tremendous amount of resources expended into increasing the capacity that we needed to address COVID here in the state of Indiana. I'm just so proud of the work of the nurses, the physicians, the facility staff, everyone in the hospital community who worked so hard to very quickly adapt and expand what we needed to address this health emergency. So working very closely with our amazing state health leaders, Dr. Christina Box and others, we were able to do things like expand the number of intensive care beds from 900 to well over 1,400 in just 3 weeks. And that took reconfiguring facilities and capital expenses. It took the purchasing of scarce and expensive equipment and supplies and work around the clock. Now, in a similar fashion, we were able to increase the number of ventilators available to patients throughout the state of Indiana to almost 2,500. That was an increase of 74% from the baseline. And we are committed to maintaining that high state of readiness. And I just want to applaud the work of the thousands of healthcare and hospital workers throughout the state who made that possible.
And like you mentioned, those huge jumps all come with costs as well. So Indiana hospitals in general reported negative operating margin. That means total expenses were greater than total revenues. And that number for general hospitals was minus 8.3%. But it's even worse for rural hospitals. They're reporting negative operating margins more than triple that at 28%. What are your thoughts when it comes to rural hospitals in Indiana right now?
I was worried. I think a lot of folks had concerns about the future of our rural healthcare safety net before the pandemic, and I think with the impact, the financial toll that we've had because of COVID, some of those facilities, I think they face an even more uncertain future, which is why we really need policies to support them. But they're working hard to make sure that they're there for their communities. There was a national study by an entity called Guidehouse, kind of a consulting research firm, and they looked at Indiana hospitals and found that before COVID, 31% of Indiana's rural hospitals were at high risk, high financial risk. So that's already a warning sign before we even got into the period that we're in now. And it's just so important, not just for the immediate public health needs that we have right now to battle this outbreak, but also for the long-term viability for those rural communities. The vitality, the ability to attract future economic development really depends on having a strong healthcare system. So this is not a time when we can afford to have those rural hospitals close. And really there has been a different kind of epidemic, but we've seen this rash of rural hospital closures around the country. Fortunately, Indiana has been so far has not mostly really seen that yet, but that trend has occurred in some of our neighboring states, particularly in the South, some of the western states, and we just want to make sure that doesn't happen here in Indiana.
So what do you think it will take for Indiana hospitals to recover, and does policy play a role in that?
I think public policy plays a huge role. When you have a crisis of this magnitude, we really need the help of our federal and state partners. And I want to laud the efforts of our congressional delegation. Since the beginning of this journey, our representatives, our senators have been reaching out to IHA, reaching out to their local hospitals, and keeping their finger on the pulse of what was happening on the ground. So asking about the shortages of personal protective equipment, asking about the other supplies that were needed for testing and critical drugs that are needed. They've really continued that dialogue. So I think they really had a sense of how great the need was. And through policies like the CARES Act that was passed and signed into law, the funding through the CARES Act is absolutely critical. There are certainly hospitals that would not be open today at this point in the summer if that legislation hadn't been passed. So there's more public policy being debated right now with important elements on the table. For example, there's an important Medicare advanced loan program that we hope will be extended in terms of the payback. That's really important to hospitals. But I feel very confident that with the kind of collaboration we've seen and coordination between our state and federal partners, that public policy will continue to support the readiness of Indiana hospitals.
Well, thank you so much for being on the show today, Brian, and sharing your perspective. Important numbers to get out there. Thank you very much.
Thank you.
Gary, back to you.
All right, Kylie, thank you.